Hi, this is your Houston chiropractor, Dr. Gregory Johnson, and we have Eva here with us this afternoon. This is Eva's 4th treatment here, and she's been having some lower back pain and pelvic pain down in her sacroiliac region that has gone down in her thighs a little bit. She also has some neck pain and stiffness and upper back pain and stiffness, and some breathing difficulties with some chronic bronchitis and stress. So we're going to work on her and show you how we get rid of all that. So let's take you and face the mirror now, Eva. Okay. I'm going to have you close your eyes for me, hon. Flex your head forward and then backwards, please. And then neutral. Take a deep breath in, let all your air out and relax, and then breathe normally with your eyes closed. Now her head's a little bit forward and turned to the left, so I bet she's a side sleeper and twists to the left most of the time. Yep. Is that about right, Eva? Yes. Yep. Blows people away when I tell them how they sleep. But you can tell everything by looking at a person's posture, because it's a mirror of spinal biomechanics, or the alignment of the spine. And her pelvis is shifted left of center line too. You see a space here and not as much space over here. Do you see that in the mirror, Eva?
Yes.
Okay. So, first thing I'm going to do with Eva then this afternoon, she's already seen Joseph for a massage, so we're going to have you lay on your back right here. Okay. And head up this way. Yep. And I'm going to decompress your entire spine, so let's scoot you down this way just a little bit. About another inch. Yeah, straight down. There you go. Okay, yep. Now, this should be right on top of your hip bone, so does that your hip feel right underneath of that? Okay. And then I'm going to do the same thing over here. This is going to feel tight, and it's supposed to. Now push yourself up away from there. Make sure you're in there tight. You're not going anywhere? Okay. So we got her locked in now. You're not going to be able to go anywhere now. Yep. This is the adjustment that really differentiates us from most chiropractors, because it moves everything from the skull all the way down to the sacrum, all 24 freely movable vertebrae. So it helps degenerative disc disease, osteoarthritis, herniated disc, bulged disc, sciatica. Take a deep breath through your nose. Let it all the way out and relax. There you go. Nope, I got another one. There it is. You feel that one all the way down?
Oh, yeah.
Okay. Okay. And she's still kicking. Okay. Perfect. There we go. You notice a lot of times when I'm adjusting people, I'll close my eyes because I get a better feel of the actual spinal movement biomechanics. Because everybody, even though it may look the same, everybody's range of motion is different, their ligaments, tensile strength is different. Okay, hon, let's go over here and lay on your tummy next. Okay. I mean, Joseph can tell you today, I had him trying to work on my back. It's a lot harder than it looks, huh, Joseph?
Very hard.
Everybody thinks adjusting is really easy on you, but believe me, it's work. Right leg is short by about 1/4 of an inch, and it gets even. Is that tighten up in your lower back a little bit, Eva?
Just a little bit.
Okay, on that right side works, right there?
Yep.
Yep. See, her right SI joint's out right there, and there's L5 right there. These are all a little tender in here, though, aren't they? Mm-hmm. Okay, so we're going to adjust her right SI joint first. And then her sacrum right in the center of her pelvis. Her left SI joint and her hip right there. And then we're going to adjust the sacrum on the left side as well. And then L5, you're going to notice, is more straight P to A in the Z axis. L4. Now L3, you'll see I've got pretty decent angle in my arm, and it's a hard, fast thrust, but you got to have tissue pull first. When people get hurt getting adjusted, it's because the chiropractor doesn't bring the spine to full tension before he adjusts. He'll get a running start at it and hit it from neutral, and that can cause ligamentous injury, creating ligamentous instability, which is again why I don't twist patients on their side in their low back and their pelvis too much. Occasionally I'll do it if they've got some muscle spasm and scar tissue down there that's freezing that joint up. But I'll do it within the integrity of the ligament so as not to sprain the ligament or create ligament instability. And a good adjustment does just that. It gets the maximum joint range of motion without interrupting or interfering with the integrity of the full range of motion of the ligaments of that area or those joints. In fact, that paraphysiological space that we open up when we adjust someone is the cracking noise that all you crack addicts love. That's the nitrous gas that explodes inside the synovial joint that is made by the synovial fluid physiology. All of us have them in all the joints of our body. That's why you can crack your knuckles or crack your knees, your elbows, your shoulders. Some people's joints are differently aligned, and some people's synovial fluid doesn't produce as much gas, so they may not make as much noise, but still move the same. The synovial fluid covers the cartilage of the joint, which is the synovial membrane of the cartilage in every joint. There. Okay, now let's take another look at your leg length here. And see, your legs are exactly even now, and this should feel a little easier this time.
It does.
Does it? Okay, good. Alright, so I'm not going to turbonate you this evening. I'm going to be nice to you.
Thank you.
Like I said, Joseph's already did some deep tissue work on her and manual therapy. We don't just do massage therapy here. We do manual therapy and stretches and therapeutic activities which will help to improve the joint range of motion and function of the muscles and ligaments and tissues that are responsible for holding the pelvis and the spine either in place or out of place. But when we're doing our treatment and rehabilitation here at Advanced Chiropractic Relief, we take care of a person three-dimensionally, mind, body, and soul. We pray for every one of our patients' healing as well every day. Renee and I agree first thing, and Joseph has done that with us as well. Because God's the one healing you, He's just using me as a tool and instrument. Same thing with Joseph, we both got healing hands. It's a little different way. We all have our own gifts that we've been given. Being gifts meant this thing wouldn't get stuck down there. There we go. There, okay. Alright. Your hamstrings are a little tight, huh?
Yeah.
You may get a little itchy when I do this because this increases the blood flow to the skin, so sometimes it'll get itchy. Okay, hon, let's turn you on your back now.
Okay.
You should feel already better.
I do feel better.
Good. Okay, so I'm going to get your leg here. I want you just to let it relax in my hand. There you go. You should have felt that in your knee and your low back.
I did.
Good. And we're going to do the same thing here. There, good. You noticed you had a little lateral play in your knee sideways?
Mm-hmm. What was that?
That's your ligaments in your knee, so I'm tightening those up too. So let's sit you up and face over that way.
All right.
Okay, so look straight ahead for me and just relax your arm in my hand. There we go. That's your right glenohumeral joint, which is the shoulder joint, ball and socket. There's the left one.
Okay.
Okay, let's check your elbows. You notice we do full body adjustments here every time. So what you see here on YouTube videos is what you get when you come in. No surprises, except for Renee. No, Renee's always the sweet, loving, beautiful wife that she is every day. There we go. Good. I'll get points for that one. Okay, now let's come over here and shoot you.
All righty.
So you can't get out of here without me pulling your leg and shooting you.
Okay.
Okay, I'm going to have you close your eyes, flex your head forward and then backwards, and then neutral. Okay, take a look in the mirror right now. See how this space opened up on both sides?
I do.
And how your head's more centered, not turned so far left, but you still have a little bit of that. So let's pull these up and back, flare these like that. We're going to bring your head straight back this way a little bit. That's perfect translation. There, and now I want you to shift your pelvis straight right. Hold that right there for just a moment. Okay, I'll try not to let you fall. I haven't lost patient on the floor yet. I won't start with you. There we go.
All right.
Now you can relax again and flex your head forward and backwards again. This should feel smoother this time.
Yes.
And back to neutral. Take a look in the mirror now. You're almost standing up so straight you're falling backwards.
I feel it. It
Yep.
feels like I'm
You're going backwards a little,
yes.
huh? How's that feel?
Awesome.
So if you were to share something with our YouTube subscribers about your experience coming here, what would you tell them?
He's a miracle worker.
Well, thank you very
I
much.
highly recommend him.
Thank you very much for sharing your story
Thank
and
you.
letting us
Thank you,
watch your
thank you.
adjustment today.
All right.
This is your Houston chiropractor, Dr. Gregory Johnson, coming to you from Advanced Chiropractic Relief in Houston, Texas. We'll see you next time.